Where to find osteoporosis fracture risk assessment with limited access. Are you wondering how to assess osteoporosis fracture risk when resources are limited? You're not alone. Many people face challenges accessing advanced medical imaging. Fortunately, there is a practical solution. The FRAX registered tool is a widely recognized and validated method for estimating the 10-year probability of major osteoporotic fractures, such as those in the hip, spine, humerus, and wrist. This tool is especially useful because it can be accessed for free online. One of the best features of the FRAX registered tool is that it does not require bone mineral density measurements to provide estimates. This is particularly beneficial in settings where dual-energy X-ray absorptiometry scans, commonly known as DXA scans, are not available. Instead, FRAX registered relies on clinical risk factors, which include age, gender, body mass index, prior fractures, and other health conditions. In many low-resource environments, healthcare providers can still use FRAX registered to estimate fracture risk based solely on patient history and clinical factors. This ability allows for effective risk stratification and helps guide treatment decisions without the need for advanced imaging. If DXA scans are not accessible, there are alternative screening tests. Peripheral bone density tests, such as peripheral DXA or quantitative ultrasound, can be more portable and cost-effective options. However, it is important to note that these tests are generally less definitive than central DXA scans. The results from fracture risk assessments can be crucial for healthcare providers. They can use this information to determine when to initiate osteoporosis treatment or recommend lifestyle changes, even in the absence of advanced imaging. This approach aligns with guidelines that emphasize the importance of fracture risk assessment in managing osteoporosis. The FRAX registered tool has been endorsed by major health authorities and is calibrated for use in many countries. This means it can be effectively utilized across diverse populations. In cases where country-specific FRAX registered models are not available, surrogate models can still be applied to provide useful estimates. In summary, when access to advanced imaging is limited, the FRAX registered tool stands out as an effective and practical method for assessing osteoporosis fracture risk. It supports fracture prevention strategies in primary care and resource-constrained environments. While peripheral bone density tests can supplement risk assessments when available, FRAX registered remains the cornerstone tool for evaluating fracture risk in these contexts. Remember, it is always best to consult with healthcare professionals to tailor osteoporosis management to individual needs.